Friends, today we will discuss about a most interesting topic in surgical field, that is cholelithiasis. This is the common condition which you generally come across in outdoor practices. Let's discuss how you will recognize this condition on ultrasound. What is its Sono-criterias and what is its shadow patterns? There are three diagnostic criteria or three sono-criterias for diagnosis of cholelithiasis or gallstone diseases. Those are: first, echogenic focus; second, cast acoustic shadow; third, seek gravitational dependence. These are the three sono-criterias for diagnosis of cholelithiasis on ultrasound. Let us discuss it one by one. Again the same thing. There are three gold standard features for diagnosis of cholelithiasis on ultrasound. Those are: first, echogenic focus; second, cast acoustic shadow; third, seek gravitational dependence. Remember, these are the three sono-criterias. Remember one important thing: stone less than 2 to 3 mm may be difficult to visualize on ultrasound. Remember, I am telling again, stone less than 2 to 3 mm is difficult to visualize on ultrasound. Let's discuss what is echogenic focus. A focus is echogenic, that means that focus is hypoechoic. In the other word, you can say that focus is bright or white in color. I have already discussed about hypoechoic, hypoechoic, anechoic, isoechoic in my previous video. Go and see the video on topic on echogenic and echotexture. Hypoechoic means less level of echo, that means less echogenic. Hypoechoic means more level of echo or more echogenic. By comparing between two organ or organ with surrounding structure or organ with a point, you can able to tell the organ or the lesion is hypoechoic or isoechoic or hypoechoic or hyperechoic. In this point, you should compare the echogenicity of the focus with surrounding structure, that is liver, to name the focus is hyperechoic or hypoechoic or isoechoic. As the lesion inside gallbladder is more bright in color or more white in color on comparing surrounding structure, that is liver, so mark this lesion is hyperechoic or echogenic lesion inside gallbladder. Again I am telling, by comparing between two structure or comparing between the two organ, you can able to label the organ or the lesion is hyperechoic or isoechoic or hypoechoic. This slide shows an echogenic focus inside gallbladder. It may be a stone, it may be a polyp, it may be a sludge, it may be a growth inside gallbladder. But one thing, there is an echogenic focus inside gallbladder. Stone and very rarely sludge have posterior acoustic shadow, and in rest cases there is no posterior acoustic shadow. And focus is echogenic. What does it mean? It means that almost all the beam are reflected back from the lesion to the transducer. Higher the beam are reflected from the lesion to the transducer, higher will be the echogenicity of the lesion. In the other word, you can say higher will be the brightness or higher will be the whiteness of the lesion. Again I am telling, higher the beam are reflected from the lesion to the transducer, higher will be the brightness, higher will be the echogenicity, higher will be the whiteness of the lesion. Let's discuss what is posterior acoustic shadow. The area which is just posterior to echogenic focus looks dark or black in color. This area is posterior acoustic shadow. This area is non-scannable, non-resolved part. I have already discussed about posterior acoustic shadow in my previous video. Go and see the video on topic on posterior acoustic shadow. As almost all the beam or 100% of the beam are reflected from the echogenic focus to the transducer, the area just posterior to it will be non-scannable, non-resolved part which appear as a black in color or looks dark. This area is posterior acoustic shadow. Higher the echogenicity potential, higher the chances of formation of posterior acoustic shadow. In the other word, you can say if there is presence of posterior acoustic shadow in a image, there must be presence of echogenic focus just anterior to it. Stone and very rarely sludge produce posterior acoustic shadow, but in rest of cases like sludge, pus inside gallbladder, blood inside gallbladder, and sometimes pigmented stone, not so posterior acoustic shadow. Let's discuss what is Sig gravitational dependence. What is the meaning of Sig gravitational dependence? It means on changing the position of the patient to other side or movement of the patient to other side, it result the movement of stone to the gravitational part of the gallbladder. On sitting position, the gravitational part of the gallbladder is fundus, but in case of supine position, the gravitational part of the gallbladder is neck of gallbladder. Look at the slide. This slide shows in sitting position the stone present at fundus, but in case of supine position the stone present at neck of gallbladder, but in case of semi-recumbent position the stone present at dependent part, that is at body of gallbladder. This slide again shows the stone present at dependent part, that is at supine position, the stone present at neck of gallbladder, but in case of sitting position, the stone present at fundus of gallbladder, but in semi-recumbent position, the stone present at dependent part, that is at body of gallbladder. That means on changing the position of the patient, the position of the gallstone changes to dependent gravitational part of gallbladder. Now discuss about some echogenic lesions inside gallbladder. Some echogenic lesions are mobile, that are sludge and stone inside gallbladder. Some echogenic lesions are fixed, that is immobile, that are polyp, impacted or adhesive stone. And another example is slow moving tumefactive sludge. Now discuss about some other mobile lesions inside gallbladder, that are sludge, pseudo sludge, blood, pus, milk of calcium bile. That means these lesions are moved to the dependent part on changing the position of the patient. Now discuss about different type of shadow pattern of gallstone. There are three type of shadowing of gallstone. First pattern, clean shadowing for solitary stone. Second pattern, confluent shadowing for multiple small stone. Third pattern, which is a important pattern, wall echo shadow for gallbladder filled with gallstone. Let's discuss it one by one. Again the same thing. There are three patterns of shadowing of gallstone. First, clean shadow for solitary stone. Second pattern, confluent shadowing for multiple small stone. Third pattern, which is an important pattern, WES, that is wall echo shadow for gallbladder filled with multiple gallstone. One point you have to remember, small pigment stones may not have shadow. Let's discuss what is clean shadow. What is the meaning of clean shadow pattern? As name suggests, a clean shadow is formed just posterior to or just behind the single solitary stone. As the slide. Let's discuss what is confluent shadowing. What is the meaning of confluent shadowing? As name suggests, there occur confluence of the shadow which is formed just posterior to gallbladder stone. Due to presence of multiple stones inside gallbladder, it shows confluence of the shadow just posterior to stone. The slide shows multiple gallstone having confluence of the shadow pattern. Let's discuss wall echo shadow. Wall echo shadow, that is waist pattern of shadowing, is seen in case of gallbladder filled with multiple stone, that is gallbladder with impacted stone inside. WES complex, that is waist complex, consists of two parallel hypoechoic line which is separated by a thin hypoechoic space having a posterior acoustic shadow. Look at the slide. This slide shows two hypoechoic line having a hypoechoic interface having a posterior acoustic shadow. This is the features of wall echo shadow which is seen in case of gallbladder filled with multiple stone, that is gallbladder with impacted stones inside. One point you have to remember, air inside the gallbladder will present as bright echo having a posterior acoustic shadow where normal gallbladder wall is not seen. WES, that is wall echo shadow pattern is seen in case of gallbladder filled with multiple gallstone, that is gallbladder filled with impacted gallstone. Waist complex means two parallel hypoechoic line having a hypoechoic interface. First hypoechoic line is formed by gallbladder wall itself. Second hypoechoic line is formed by gallbladder stone itself. And in between two hypoechoic line there is a hypoechoic interface which is formed by bile and inner muscular layer. Look at the slide having two hypoechoic line having a hypoechoic interface having a posterior acoustic shadow. Look at the slide showing two hypoechoic line having a hypoechoic interface with a posterior acoustic shadow. This is waist complex, that is WES complex, which is seen in gallbladder filled with multiple stone. Look at the slide having WES complex. Look at the slide having WES complex, that is waist complex, seen in case of gallbladder filled with multiple gallstone. Look at the slide showing waist complex seen in case of gallbladder filled with multiple gallstone. There are certain conditions which are confused with diagnosis of waist complex, that are overlying bowel loops, second porcelain gallbladder, third thickened falciparum ligament, fourth gallbladder bed after cholecystectomy. In the next slide we will discuss how to differentiate between porcelain gallbladder and waist complex. Thank you. Thanks for watching. Have a nice day.